So the kidneys are the important organs of the human beings and most of the animals, which are very much required for the excretion of unwanted material from the body and also to balance the electrolytes. So, in the abdominal cavity of an animal, the kidneys are located on both sides, in which the left and right kidneys are located. Then this is the location of the kidney. Right kidney is little upper, left kidney is little lower. And this is the retroperitoneal muscles and organs and dorsal wall of a bitch with ventral aspect. So these kidneys are connected with the urinary bladder with ureter. Both ureters are there. Then the right and left kidneys are highlighted here, which are the kidneys are supplied by the celiac artery. Then cranial, mesenteric and celiac ganglion are there. Then cranial, mesenteric artery, right renal artery is also supplying, and the vena cava is caudal vena cava. So this is the right ureter, this is the left ureter. Then the uterus horn is located here, which is extended up to the kidneys, and caudal region is there, and right external iliac arteries are there. Then this is the uterus. Ovaries are present in the ovarial bursa, left and right ovaries. And these two small structures are the uterus. Then femoral vein, etc., are located in a dog. And this is the transverse section of a feline abdomen with caudal aspect. So here we can see the left and right kidney, which are embedded in the kidney fat. And of course, this is the spinal cord, the white structured one, and musculature on the trunk are located here, and the descending colon, etc., can be seen. But now we are going to focus on the kidneys. So this is a structure of the kidneys, both left and right kidneys, which are connected with the urinary bladder, with the ureter, and the bladder is located below the uterus of a mare, and urethra is the external opening, whereas in case of males it is a little bit the location is almost same, left and right kidneys which are connected with the ureter with that of the urinary bladder, but the urethra is comparatively long in case of the stallions when compared to that of the mares. And here you can see that the internal organs, especially the esophagus, then cecum, small colon, then rectum, anus, and kidneys are located here. This is the location of the kidneys below the vertebral column. And the horses are usually the colonic digesters, hence the colons and cecum are very large here. And of course, this is the ox kidney and also the pelvic organs with the right lateral aspect, abdominal wall, and the greater momentum is removed here, and we can see the different structures which are adjacent to that of the kidneys, and at the same time we can also see the organs of the pelvic cavity. So here you can see the kidneys, right kidney is always lowered in case of the bovines are concerned, and left kidney is just below that particular kidney. And these are the right hepatic lobe and omasum covered with the omentum, and reticulum is placed here, and small intestine, and the cecum, then urinary bladder is located just below the genital organs. And usually the kidney is a bean-shaped reddish brown smooth surface except in case of horses, and basic form is bean-shaped in most of the animals like dog, cat, sheep and goat. And right kidney of the horse has a valentine heart shaped. So here you can see, and left kidney of a horse has a bean to pyramidal shape. So there is a difference between the right and left kidneys. And bovine kidney is irregular, oval shaped, superficially fissured into lobes. So this is the kidney of a dog, which is bean shaped, cranial extremity, lateral bladder, and caudal extremity. Whereas the renal medulla is going to open here, and renal pelvis and renal cortex are like this, especially in case of a dog. Whereas the ox kidney is multiple lobulus, and the ureter is extruding out, whereas the horse, this lateral border is having little oval shape, whereas the left kidney is having the superficially feeds into the lobes. And kidney shape and appearance, dorsal and ventral surfaces are there, cranial and caudal extremities, then renal hilus intended medial border for passage of renal pelvis, vessels and nerves. And renal sinus is fat-filled space here around the renal pelvis. So the ox kidney or the cattle kidney has got cortex and medulla. So this is the renal lobe, then renal artery and the vein, then the white structure is the ureter, and the kidneys are always multilobed in case of ox, and apex of lobe forms a papilla and it's fit into cup-shaped expansion which is called as the calyx, especially in case of the renal pelvis, like pelvis you can see, and the external zones, and it is got the multiple lobular kidneys. Then kidney structure is looking in case of a dog like renal medulla, renal cortex, then renal crest is there, and the dog, horse, and sheep do have similar type of the kidney. Lobes fuse into form a single medullary mass with continuous cortical cell. Papilla fuse to form a single renal cortex. So these are all the kidney of a dog, which is very similar to that of the horse and also in case of sheep. So all are the lobes fused and bean-shaped kidneys. Whereas in case of ox, it is totally a different kidney than dog, horse, and small ruminants have a unilobular kidney with smooth surface and single papilla, whereas multilobular kidneys with ox, especially in case of surface, multiple lobular kidneys are there. So dogs and other animals do have the unilobular bean-shaped kidney. Then the kidneys of dog, cat, horse, and all these small ruminants do have got smooth surface and fused cortex and fused medullary lobes, and renal pelvis and renal sinus are the characteristic features of the kidneys. The ox kidney has got multilobular, fissured surface, unfused medullary lobes, and renal papillae are there. So, coming to the kidney as a functional unit, it is got the nephron, just like the neuron. And in case of kidney, the basic cell is a nephron. So it is containing the glomerular capsule, then proximal convoluted tube, loop of Henle. The entire structure is called as loop of Henle, and it has got descending limit, U-turn or V-turn, and ascending to a turn, and distal collected tubule. The proximal and distal collecting tubule followed by the collecting duct, etc. So the distal convoluted tubule is having the structure like this: renal cortex, renal capsules with glomerulus and Bowman's capsule, renal pelvis at cribriform areas, and cribriform areas are confined to the apices of independent papillae, and specific regions of a common crest like cat, dog, and small ruminants have got the different type of the schematic representation of the kidney. So this is the deep blood vessels of left kidney of a cat. So cat kidney is also bean shaped, non-lobular. So this has got the interlobular arteries, arcuate arteries and veins, and location of the renal pelvis is like this, and also it has got renal veins and renal artery. Then coming to the ultrastructure or the histological structure, here we can see that the proximal expanded part of the ureter in all domestic animals other than the ox. All the papillary ducts open in renal pelvis. This is the renal pelvis located within the renal sinus. Then renal pelvis has got specific difference. Dog and cat molded around the renal crest and extends ventrally and dorsally to form pelvic recesses. So the renal pelvis is, there is once again specific. The renal pelvis is absent in ox. Papilla of each medullary lobe fit into a minor calyx. So this is the ureter of an ox with renal calyx and Corosian cast, and the unite into two major calyces converge from both poles of the kidney to form a single ureter. Then this is another structure, renal pelvis specific difference is there in between the species. Horse has got a central gravity. This is the one, whereas the mucosa of renal pelvis produces the mucus secretion which accounts for the proteins normally present in the equine urine. It has got more and more proteins. So this structure which is noted here is a ureter, then terminal access with injected papillary duct, etc. Then terminal access with injected papillary duct on both sides, renal pelvis. So female urethra is also very similar to that of the male urethra, but it is lesser or shorter in case of dog. Then it has got, the bladder has got neck, extends caudally on the pelvic floor, passes obliquely through the wall of the vagina, opens at external urethra, opening at the junction of the vagina and vestibule on the ventral floor. And the short and wide in case of horse, comparatively long in the dog. In cow and so the urethralis muscle encloses the suburethral diverticulum which opens together with the urethra into vagina, and this arrangement can cause difficulties during the catheterization, especially in case of the horse or the dog. In case of cow and so there is a muscle called as urethralis muscles. So it encloses a suburethral diverticulum and which opens together with the urethra into vagina. So sometimes it may be different. So male urethra is always longer than that of the female urethra, and the pelvic part is pre-prostatic portion is there, then prostatic portion, penile part, etc. Then the kidneys, or they are also called as the reins. So they are a pair of excretory organs situated on the posterior abdominal wall on each side of the vertebral column below the peritoneum. And location of the human kidney is like this. Both the right kidney is slightly lower than that of the left kidney in case of the human beings, and it is also very similar in case of the other domestic animals. So the external features of a kidney is always in case of human it's bean shaped and the lower pole is pointed and it is bordered very similar to that of the kidneys other than the ox which is having lobular kidneys. So usually the lateral border is convex and concave structure in the middle it is border depressed and known as hilum. The structure where it differs the structure is called as the hilum. So it is about 5 centimeter. Then total height of a kidney in case of adult human being is about 11 centimeter. The color of a kidney is reddish brown. Then it is the in case of males in human beings 150 gram. Female it is less, so there is 135 grams. So usually the kidney is lobulated and made up of 12 lobules. After birth, lobules fuse so that the adult kidney is uniformly it is smooth. Before birth, it is lobulated. And here you can see that the iliac crests are present and anterior aspect and posterior aspects. Usually it is 7.5 centimeter width and in the upper part it is 2.5 centimeter. So it has got three coverings, innermost fiber capsules or true capsule and middle fatty capsule and peri nephric fat is also the collection of fatty tissue. The false capsule is made up of renal fascia, has got two layers, anterior and posterior layers. So here you can correctly differentiate suprarenal fat is there or suprarenal. Then this side is covered with the spleen, the right side kidney is having the border with that of the liver, then duodenum, then the aorta, then the vena cava are both supplying to the renal artery and renal vein respectively. Then the anatomy of the kidney, macroscopic structure are like the major calyx are there, calyx. These are called as the calyx. And the renal pelvis is the one where in which the urine stores transiently, then it dribbles through the ureter into the bladder. Then renal medulla, then the outer one is renal cortex. Inside it is renal medulla. Outside most post is called as the renal capsule and the renal pyramids are like this, the lobular type of the structure. And the functional unit of the kidney is a nephron, consists of the renal capsule, proximal convoluted tubule or PCT, then loop of Henle and distal convoluted tubule. Then cortical nephrons have short loops of the Henle, whereas the juxtamedullary nephrons have long loop of the Henle. Then the 15% of nephrons are juxtamedullary. The glomerulus is the capillary bed that filters the blood inside the Bowman's capsule principally based on the particle size. Then the filtration membrane is formed by fused basement membranes of the podocytes in the capillary endothelial cells. Then the contractile mesangial cells further perform a role in regulating the rate of the blood flow, and blood pressure is also maintained by the kidney. Then specialized cells in the juxtagranular cell produce paracrine signals to regulate blood flow and filtration rates of the glomerulus. Other juxtagranular cells produce the enzyme renin, which is playing a central role in blood pressure. The filtrate enters proximal convoluted tubule, where absorption and secretion of several substances take place. The descending and ascending limbs of the loop of the Henle consists thick and thin segments. The absorption and secretion of the distal convoluted tubule, etc. So the cortex is a pale pink color. It's having the glomerulus. Most of the glomerulus are present here. Then proximal and distal convoluted tubules are present. Whereas the medulla part of the kidney, loop of the Henle will be present and collecting ducts will be embedded there. Then pyramids. Whereas the renal pelvis is a structure which is containing the hilum, then major calyxes and minor calyxes. So the kidney has got the frontal section in which you can see the minor calyx, major calyx, and the renal artery, renal vein, and ureter. The outermost coat is called as the renal cortex, then pelvis, then medulla. Inside structure is medulla. So minor calyx is a cup over papilla that collects the urine. Here it is the one which is collecting the urine. Then anatomy of the kidney of most of the animals is like this: cortex, medulla, renal capsule, minor calyx, renal column, and renal pyramid. This is in between the structures, in between the renal pyramid, there will be renal column. And renal pelvis is the one where the urine is temporarily collected and passes through the urethra to the urinary bladder. And renal papillae is like the structures. Then renal cortex is about 1 centimeter, outside is about 1 centimeter. Then renal medulla and columns and pyramids, and also the papilla are made up of the medulla, lobe of the kidney, pyramid and its overlying cortex. So the microscopic structure is like it is divided into renal cortex, renal capsules, nephrons are the entire big structures, nephrons, and collecting ducts are the here, and renal medulla is there, and minor calyx where the urine is structured. Renal papilla is also there. And if you take a cross section, then the kidney may be regarded as a collection of millions of uriniferous tubules, and each of such tubules are termed as the nephron of a collecting tubule. Each kidney contains about 1 to 2 millions of nephrons and thousands of the collecting ducts. So each kidney contains about 1 to 2 millions of the nephrons or cord structure, and 1 to 2 million 1 to 2 million nephrons and thousands of collecting ducts, big collecting ducts. So outer cortex is like this, and the Bowman's capsule is stained very specifically, and also the inner layers can be seen. Then structure of a nephron is, suppose this is the nephron which is extending from the renal cortex to the renal medulla, and each of nephron is supplied with the renal arteries. Throughout, the blood will go out through the renal vein, and this is the structure of a nephron. Then efferent arteriole is coming from the renal artery. Then afferent arteriole is the one which is going out afferent away from the organ, and it is going to supply. Then the efferent arteriole is surrounding throughout the entire nephron, and the peritubular capillaries are the branches of the efferent arterioles. Then they are all surrounding the nephron, and the structure wherein the blood is squeezed is called as Bowman's capsule. Then the structures till this one is called as the proximal convoluted tubule, and the same side, the next side, it is called as the distal convoluted tubule, and the Henle loop of the Henle, one is descending and one is ascending, and the peritubular capillaries always surround the loop of the Henle, the proximal and distal convoluted tubules, and they are going to end up in the collecting duct. Then proximal convoluted tube and distal convoluted tubules both are going to contribute to the formation of the urine. The nephron is a very special structure in the kidney which receives the blood from the renal artery. Then, after filtration, it is surrounding that particular nephron, and the exchange mechanism takes place between the loop of the Henle and also the tubular reabsorption takes place, and urine refreshes the blood. It has got a very specific structure, and here you can see the afferent arterioles. So they are going to supply the blood to the kidney, and efferent arterioles are taking out the blood of the kidney, and finally they form the they are going to join to the vena cava. Then glomerulus is a filter-like structure, and this entire structure is called as the Bowman's capsule. Here, due to the pressure, different materials are squeezed in this thing, and once it gone down, that's the proximal convoluted tubule, etc., it is going to squeeze so many wanted material, and many of them get reabsorbed, which are required to the body. And the visceral layer of Bowman's capsule is looking like the chocolate brown colored organ in most of the species. Then this is the this histological structures. The space of Bowman's capsule is also known as sinusoidal capsule, and proximal and convoluted tubules are looked as the distal convoluted tubules are a little bigger than that of the proximal convoluted tubule. Most of the here you can see. And whenever there is a pathological change, surely we can find some restoration of these particular renal tubules. So how the kidney is supplied with the blood is arterial supply. One is the renal arteries, whereas the venous drainage is from renal veins and seen inferior vena cava. Is the vena cava which is below. The left renal vein is longer than that of the right. Nerve supply, almost all the kidneys are supplied with T10, and the L1 segment and parasympathetic fibers from the vagal nerve. Then lymphatic drainage into lateral aortic nodules directly. They have nothing to do with that of the kidney. Then kidney functions. What are all the kidney functions? Number one, it filters the blood plasma, eliminates waste, returns useful chemicals to the body. So sometimes in the glomerular filtration, very much required materials like the amino acids, etc., are taken up by the capillaries. They are also trained, whereas the other things cannot be done, and regulates the osmolality of the body fluids, because sometimes if the sodium etc. are more, then there will be more thirst, and also the recurrent urination may also happen. Whereas the endocrine system, there are two endocrine systems are there. That's the synthesis of the acid protease, or it is also called as renin. And it is the enzyme involved in control of blood pressure and blood volume. So angiotensin is converted to angiotensin to renin. And because of all these things, and beta erythropoietin synthesis. So the deficiency of beta erythropoietin always leads to anemia, and the anemia is seen in case of the animals with chronic kidney damage, and it responds to the decrease in oxygen concentration. Then erythropoietin acts on specific receptor expressed on surface of the CFU for erythrocytes in case of the bone marrow, and secretes erythropoietin, which controls the RBC count and regulates the PCO2 and also the base balance, acid base balance, and detoxify the free radicals like H2O2, and the many of the drugs administered has to go to the renal system for the clearance. That's about the system of the kidneys, and the kidney conditions like many diseases are there: kidney stones, glomerular nephritis, pyelonephritis, etc. are there. Then nephrotic syndrome is a stage in which damage to the kidneys causes them to spill large amounts of protein into the urine, or this leg swelling edema may be a symptom. Damage to the kidney cause them to spill large, the nephrotic syndrome. Then polycystitic kidney disease, genetic conditions resulting in large cysts in both kidneys that hinder the kidney function. And acute renal failure, a sudden worsening in case of the kidneys work, and suddenly there will be dehydration and a blockage in the urinary tract, or kidney damage can cause acute renal failure, which may be reversible also. Whereas the chronic renal failure, a permanent partial loss of how well the kidney works. Diabetes and very high blood pressure are the most common causes of the chronic renal failure, which is unmanaged. And diabetic nephropathy is a syndrome in case of humans, dogs, and cats. High blood sugar from diabetes progressively damages the kidneys, eventually causing chronic kidney disease. So the protein in the urine, like the nephrotic syndrome, may also result. The hypertensive nephropathy means kidney damage caused by high blood pressure. Chronic renal failure may eventually it may result. Whereas the kidney cancer is also another carcinoma, most common affecting the kidneys, Smoking is the most common cause of the kidney cancer, but many times non-smoker also do get the kidney problem. Whereas interstitial nephritis is inflammation of the connective tissue inside the kidney, often causing acute renal failure. And allergic reactions and also drug side effects are the usual causes. So kidney tests once again very simple urinalysis, routine urine tests are being done by the machine, and the urinalysis can help to check the functioning of the kidneys. Sometimes the direct infection or to detect infections, inflammation, microscopic bleeding, and many kidney disorders can be sent through urine analysis simply by checking the pH of the urine, etc. It gives a diagnostic clue. Whereas the kidney ultrasound, a probe placed on the skin reflects the sound waves of the kidneys, creating image on the screen. And ultrasound can reveal blockages in the kidney flow, stones, cysts, suspicious masses, etc. Whereas the CT scan or computed tomography is better than that of the ultrasound. Takes a series of X-rays and a computer creates detailed image of the kidney (CT). And MRI or magnetic resonance imaging is also a scanner, uses radio waves in a magnetic field to make high resolution images of the kidney as the medical diagnosis is being advanced. And of course, there are the old golden standard tests like the urine culture and sensitivity test to find the bacterial infection and cause of the cystitis, urethritis, etc. Then uteroscopy is also done using an endoscope with flexible tube with camera on its another end, and is passed through the urethra into the bladder and also to the ureter. So uteroscopy presently generally cannot reach the kidneys themselves, ureteroscopy, but can help to treat conditions that affect the ureter. And kidney biopsy using a very fine needle inserted into the a block, a very small tissue or piece of the kidney can be removed using the surgical technique, and examining the kidneys will tissue the microscope may helps the diagnosis of sometimes the kidney problem. Treatment of the kidney diseases with antibiotic, then nephrostomy, it depends upon which type of the kidney problems are there. If it is a simple urinary tract infection, then either acidifying or basifying the urinary tract will simply eliminate the infectious agents. But sometimes it may not be enough also, and so one need to do the lithotripsy. Some kidney stones may be shattered into small pieces and lodged here and there. So these can also pass through the urine, and most often lithotripsy is done by a machine that produces and shock waves through the body. Nephrectomy, surgery to remove kidney, is performed whenever there is a severe problem of the kidney like cancer or severe kidney damage. Then the dialysis is one of the artificial filtering of the blood to replace the work that damaged kidneys can do. Then hemodialysis is most common method of the dialysis in the United States of America and most of the countries. As well as a person with complete kidney damage So, a person with complete kidney damage failure is connected to a dialysis machine which filters the blood and returns it back to the body automatically. So, hemodialysis is typically done for 3 days per week in people with the severe kidney damage. And peritoneal dialysis is also another method of placing large amounts of special fluid in the abdomen through a catheter, which allows the body to filter the blood using the natural membrane lining, especially in the abdomen. And after a while, the fluid will be drained out with the waste and discarded. Kidney transplantation is also being taken up in case of the human being or placing a kidney of a donor into the recipient, especially the kidney disorders and restore kidney function. The kidney may be transplanted from a living donor or perform a recently deceased organ donor. So this type of the kidney transplant, etc., are becoming the boon to the animals or to the human beings which have got the damage. And that's about the particular topic, the kidney and its functions, etc. Have a nice day. Goodbye.